Hi, I'd like to talk to you about a topic which is really important, especially in the next year to few year time horizon. It's the issue of EHR incentive reimbursements. Now, many of you are already involved with deploying or have already deployed electronic health record or EHR systems. And as you know, the US federal government is providing incentives starting in early 2011 all the way through 2015, which enable you to get higher Medicare reimbursements. And there's a real incentive to deploying early. Now the key thing is, as you're probably already aware, you have to achieve meaningful use of the EHR system. And there's a variety of conditions and criteria. My main message is that Meru Networks is working very closely with many hospitals and many healthcare organizations to ensure that they can prove meaningful use for EHR. And some of the key ways in which Meru's technology uniquely helps you in that. The first is the simplicity of deployment. Right? When you deploy a Meru network, it's really a different environment than when you deploy a microcell or let's call it a traditional wireless LAN network. The key thing is that we're very tolerant of bad radio frequency or RF environments. And in healthcare, I hate to say, that's predominantly what you face. So what makes our environment much easier to deploy is that there's really minimal RF site planning and RF site surveys that have to be done before you deploy. And then after you've deployed, there's very minimal tuning that's needed to maintain 100% coverage and full connectivity, despite the fact that you've got a lot of changes in your RF environment. And that's really critical because many of the things that you need to prove meaningful use of in electronic health records are connected to a wireless network. So for example, CPOE, computerized physician order entry. In most cases, your doctors and physicians are going through the healthcare facility with a tablet, with a wireless device, and making sure that as they're going through the rounds, roaming through the hospital, that they don't get disconnected and that there's no re-authentication or time delays, right? Productivity is a concern. So Meru's network includes technologies such as virtual cell and virtual port that ensure that there's no handoffs by the client, the physician's tablet in this case, as you roam. And by doing so, we make sure that there's no disconnects that happen, and we also ensure that the quality of service that's delivered is maintained at a very high level. So for CPOE, which is a critical part of enabling meaningful use of EHR systems, we have unique technology that improves that for you. As well, we have very close relationships with all the leading vendors, whether it's telemetry equipment, patient monitoring equipment, nurse call systems, CPOE, and of course the actual EHR environments themselves. We've maintained and deliver a very close relationship with these vendors. We have our own labs here in our corporate headquarters, and as well we work with our vendors at their facilities. So we do joint interoperability testing, and the result of which is that you have not only an ensured performance out of the box, a great experience, but also you can rely on us to deliver best practices notes, interoperability guides, and so forth. So as you go down the path of achieving meaningful use and gaining all the advantages of an EHR system, independent of course from the financial benefits, it's just simply good patient safety and good practice. And so Meru Networks is here to help you achieve not only meaningful use, but actually an improvement in the productivity, efficiency, and operating costs as you deploy electronic health record systems. Thank you.